So today our lecture is on Tourette's, and I want to go over the diagnosis, but I also want to talk a little bit about my own experience with students and clients with Tourette's. Um, so, I've never experienced this myself, but I have counseled uh, quite a few students and clients who suffer from Tourette's. Um, I would think about it like um, somewhat similar to those uh, people would consider them uncontrollable impulses, but technically they are, but they don't believe they are. Uh, like OCD, but it's distinct. It's distinct from OCD. Um, so, uh, if you've ever had an impulse and it was extremely strong but irrational, you get a very slight taste of what this might be like. So, when I was an elementary school counselor, of course, like third grade students, and there's a student in one of the classes that has Tourette's, and um, he would vocalize and shout out swear words, curse words that were not appropriate. Now, it's usually things that are not appropriate because um, people with Tourette's feel as though they are required to suppress these urges. However, because they're not socially acceptable, however, um, the more they think about it, the more they try to suppress it, the stronger that impulse becomes. So it's almost like saying, whatever you do, don't think about the blue monkey. The more you try not to think about the blue monkey, the more you're actually thinking about it. So, um, so one thing I think that helps, it won't cure it, but it may uh, relieve some of the symptomology. So, as an elementary school counselor, of course, when the student would shout out a curse word, all the other kids would laugh. That would reinforce it. Um, and the teacher would get upset. And of course, the more he would try not to do this, the stronger the impulse becomes. And so eventually, teacher requested that I make an appointment and see what I could do to help. So the first thing I did was um, tell the student they are allowed to do whatever impulse they feel compelled to do in my office, whether it be yelling out curse words or other vocalizations. It's fine with me. It won't bother me. Don't worry about it. And of course, I'm a new person. They're just meeting me, and they have some heightened anxiety. So um, they do make some vocalizations and yell out some curse words and things like that. But I don't respond. I At the most I say, don't worry about it. It's fine. So the less attention I pay to it and the less reaction, the less suppression they feel is needed. That actually lowers the anxiety and the impulse. So the other thing I did was I explained what Tourette's was to the class. Um, I talked about, you know, how many times do you have to respond to a curse word before it's just not funny? And, when the class stopped responding, and it just became a normal thing, as normal as that could be, uh, the occurrences lessened. And more importantly, I think the students' stress was lowered. Um, so it didn't extinguish itself, but it lowered considerably, and more importantly, the student felt much more comfortable. Um, so that's really uh, one of the things that I feel helps. The other thing is, if a person that has Tourette's is mindful and very focused on something, like there are surgeons that have Tourette's, but they are so focused on what they're doing, the symptoms are extinguished while they are performing surgery. So that focus and mindfulness can also reduce symptomology. Doing something like martial arts or yoga or something like that, um, being around animals like riding a horse or doing things with other animals seems to help. It shifts the focus from the symptomology or from suppressing the symptomology to the present moment. So let's look at the notes. Tourette's there was a man named Tourette who created this diagnosis. He was a Frenchman in Paris. When he made the diagnosis of Tourette syndrome. So, diagnostic criteria: multiple motor and vocal tics. The tics occur many times a day, recurrently throughout a period of more than a year. During this period, there is never a tick-free period of more than 3 consecutive months. The onset of the disorder is before the age of 18. It's usually very early. The tics are not due to direct physiological effects of a substance or general medical condition. I would say that there are some theories that some medication can affect people and lead to Tourette's, but they have not proven that yet. And there are some theories that some of the medication for ADHD could lead to that, but it has not been proven. I do know that over-medication can lead to permanent tics. In fact, it's one of the things that tells me a child is over-medicated. So caprolalia is the involuntary utterance of obscene words, often experienced during stressful times. Symptoms usually peak early to middle adolescence and decline by early adulthood. Sorry, that says childhood. I think it should be adulthood. Tics usually appear first in the face, then progress to other areas of the body. It's highly comorbid with OCD. There may be a connection there. 2 to 10 times more common in boys than girls. Etiology: some researchers believe that it may stem from an impairment in the central nervous system involving the dopamine system. Heredity: evidence suggests that Tourette's syndrome can be transmitted in families. This may be related to other genetic environmental factors. Treatment: atypical antipsychotic medications which block dopamine are often useful for the treatment of this disorder.